welcome to another episode of What Does Wellness Mean to Me? And today our special guest is Dr. Mike Faber. He is with South Suburban Chiropractic, Laser, and Calmare, and they are in Orland Park, Illinois. Welcome, welcome. Thank you for coming out and joining us today.
Thank you for the invite. Glad to be here.
Good, good. So, our topic is wellness. What is wellness? How does it present itself for you personally as well as business-wise? Mm-hmm. But first, I would like for you to just kind of introduce yourself to our audience. Tell them a little bit about you, what you do, your background, and so forth.
Okay. Well, I was born and raised in south suburbs of Chicago, South Holland. And my dad was a chiropractor in South Holland for about 45 plus years. And so that's kind of my upbringing. It wasn't the traditional Western, allopathic medicine type of upbringing at all. But kind of went into healthcare by default. Kind of wanted to go into marine biology. Yeah, Jacques Cousteau, and I was going to play third base for the Cubs. That kind of got dashed right away. Wanted to be an orthopedic surgeon. That got kind of dashed, and on and on. But anyway, loved the sciences and always was attracted to that. So when I finally decided what I was going to do, I went to Thornton College for a couple of years, took their pre-med courses there, and really liked that a lot. And then, of course, got accepted at now it's called National University of Health Sciences. Transferred over there, got my bachelor's degree in human anatomy and physiology, and then, of course, the chiropractic branch of that university is National College of Chiropractic, and then 1985 got my Doctor of Chiropractic. So that basically is, in a very, very small nutshell, my upbringing and background. And so, yeah, I was never really exposed to the traditional Western medicine type of route. Yeah. My dad was definitely not in that lane. And he did things a lot differently than most people do. And I didn't even realize there was a difference with that.
Until you got older.
Until I got older.
And then like, wait a minute. I never took that stuff. I never had that.
Never did. Not at all. So, yeah, just in that realm, I was never vaccinated as a child. So I've had no vaccinations at all whatsoever. So that kind of puts me in a different lane. Maybe not so much nowadays because of post-COVID and stuff and a lot of the questions there, but definitely was not your normal, typical kid growing up in school,
And then how long have you been doing chiropractic care? And
Well, I'll give you the short version on that. So I got out of school December of 1985, and so I worked with my dad. That was the easiest thing to work with. Worked with him in South Holland. He's always had his clinic in South Holland. And so I worked there for a number of years. Got out of it for a number of reasons. And then when my father passed away, my mother asked me, well, do I, want to take over the clinic? I said, no, I don't want to do that. I don't want to get back into healthcare with all the insurance hassles and a lot of things there. So I didn't. But then I hurt my neck one day, and I ended up at South Suburban Chiropractic Clinic with Dr. Mark Grinnell. And over the course of being a patient of his for 3 years, he kind of, conned me or sucked me in or lured me in to getting my license reactivated. So encouraged, yes. So I got my license reactivated in 2012 and have been there ever since. And now I am the sole owner and sole clinician of the clinic right now.
So tell us a little bit more about, because you don't just do chiropractic care, you also do laser and Calmare.
Yep. So the clinic has really morphed over especially the past 4 years since my partner passed away. But even before that, Dr. Grinnell had brought in a couple of different services, a couple of different therapy. One was, of course, weight loss, kind of developed his own thing, which we don't do anymore. But he also brought in MLS laser, which you are very familiar with, and started really emphasizing that as one of our primary therapies, along with chiropractic. And it was a great complement for that. So we've been doing that for 12 years, and it really has kind of taken over the practice. There seems to be a real need for people to find holistic, non-invasive options for managing their pain and for just it being healed, you know. And so that, along with you know, patients looking for something else besides the drugs and the surgeries. So the MLS laser has really opened up a lot of opportunities for patients, as well as to see people get excellent results and recovery without all the side effects of, you know, the medications and the surgeries and all the other things. So Calmare therapy came into my lane of vision, I guess, probably 3 years ago by accident. And what the laser does, the laser stimulates cellular activity. You know, it does have an analgesic effect, but also has a great effect on making the healing pathways more efficient, body working better. Calmare just changes the signaling of the nerves. So it really affects more patients that are having neuropathic pain, you know, neuropathies, things like that, where nothing else will work. And so it changes the signaling. It doesn't fix anything, doesn't stimulate any healing, just changes the signaling of the nerves. And so that's kind of really a good niche for us. So we kind of left chiropractic a little bit. We didn't leave it totally. There's a chiropractor on every corner, so there's not a shortage of chiropractors. So to find something where it kind of separates us from the crowd, the laser therapy and the Calmare therapy are definitely ones that really do that for us. And especially now, we're the only provider, I think, in Illinois for Calmare therapy. It's very limited, and there's not that many out there.
Yeah, and I do know that, you know, patients are looking for things more holistic.
Absolutely, yep.
Pain medicine in general is just, you know, with all the side effects and all the other things that come about. It's like, oh, take this, but then you're going to also have to take this, this, and this because you're taking this. So your one set of, or your one drug turns into 4 drugs just to keep you from having all the side effects of the first one. And you know, patients come in to the clinic and they're on this, and this, and they're like, and none of it actually helped. I got on this for pain, I had to get this for the side effects, and then I'm still in pain, and I'm still suffering. I'm still unable to do whatever activity. And so it's like, well, you did gain something, a list of prescriptions, but you didn't get your goal or what you set out to be. And so I think holistic wellness in general is just kind of on the rise, because like you said, people are looking for something different, something not mainstream, and things that hasn't worked in the, you know, worked in the past for them. They're
just, it doesn't work.
It doesn't work.
I mean, I tell my patients all the time, there's nothing wrong with medications and drugs. Short term.
Yes.
You have a surgery, whatever you need, meds are wonderful. Get you through that initial phase of pain. But you're on pain meds for long term, you're going to run into a lot of trouble, and you're going to find out how very little they really help. And that's the key thing, because people are, as you know, come to me with pain. I go, what's your pain level? You know, 1 out of 10. Oh, it's about a 7. What kind of medications are you taking? Well, I'm taking Lyrica, I take gabapentin, I'm taking this. And you're still at pain at a 7? Well, it's better than an 8. I go, well, yeah, but
but okay. And then how long have you been on this?
Yes.
And then if it's still at a 7,
that's right.
And how long has it been at a 7? Oh, you know, it usually averages a 7 for about the past year. Okay, then it's not working. It's not doing anything. You don't want to just manage pain. How about getting out of pain?
But this is what my doctor tells me I should be taking. I go, okay, well, that's one opinion, you know. That's one opinion.
Other things, yes. And I've mentioned in past episodes how, as a clinician, you know what's in your bag, right? Your tool bag. You're a specialist at the thing that you do. And so if you go to an orthopedic, they have a specialty. If you go to your neurologist, they have a specialty. PT, chiro, it's the same. And like you said, it is one opinion. It doesn't mean it's the end all to be all.
Right.
So as patients, we need to be advocates for ourselves. If you tried something and it didn't work or give you the results that you were looking for, move on to something else. And even inside of professions as well. I know for PT, and I imagine it's the same for chiro, chiros adjust different ways. PTs treat different ways. So just because you've gone to one,
that's right,
doesn't mean that the second and third are going to be the same. And I use this analogy with patients who tell me, "Oh, I tried PT and it didn't work for me." I say, "Okay, have you ever gone and gotten a bad haircut?"
That's right.
And they say, "Well, yeah." I said, "Did you stop getting your hair cut? Or did you just find someone else?" So it's not any different than a beautician or a barber or someone who does hair or nails. You know, ladies like to have their nails done. You go to someone that messes up your nails, you're not going to be like, "Oh, I cannot get my nails done. My nails just can't be fixed." You're just going to find someone else to do the work for you. And sometimes that has to be the case within different professions as well, looking to try to get a different service.
I'm always honest with my patients too. I said, this is the way I treat patients. It may not be for you, you know. I have different ways as a chiropractor to adjust the spine or a joint. But if this is not to your liking, I mean, if you're looking for a specific technique, and there's many techniques, even with your profession, that's fine. I'll be honest with you. So this is what I do. If it's not your thing, you're not going to hurt my feelings if you go somewhere else. But I said, I'm old school. I'm more hands-on. I don't use a lot of the machines. I don't use a lot of the activator techniques or
stretching.
Exactly. I don't do a lot of that, but I'm more hands-on. That's just my upbringing. That's how it was modeled for me by my father as a chiropractor. And I get good results for the most part, you know. And if not, if you're looking for something else, then I'll point you in the right direction, you know. And so, but in what you're talking about before, is that I also tell my patients, chiropractic or MLS laser or Calmare, it's one piece of the puzzle.
Right.
So if you're looking for a miracle stop shop, you're never going to find it. Really, what like you're talking about and what you're probably getting is healthcare, wellness really includes a lot of facets.
It does.
And so chiropractic is one facet. I says, I can adjust your spine all day, but if you don't have proper muscle tone, you don't have core strength, says you need to go see Jamaica and get that evaluation there. And I don't do, some chiropractors will do kind of rehabilitation exercise. I do basic. I'll give you some basic stuff. But if you need some more, specific attention, you need to see, a physical therapist and specifically Jamaica, because the franchises are not quite the same as coming by you and Ashley. Wonderful. And you guys spend that one-on-one time that's necessary to find out what the problem is and put out a very specific protocol and plan to get you to your goals. That's important.
Yeah, and like you said, everybody is different. They have their different approach, their different certifications we were talking about earlier, their different thoughts and stuff. And, and it's not just one thing. Everything works together. And that kind of leads into our, topic of wellness. It's not just physical wellness, but it's also mental, emotional, spiritual. It's not just one thing, because when patients are in pain, I think you mentioned this in a previous conversation, when they're in pain, it's not just physical. It is really psychological and emotional that they have to deal with and process and try to, figure out, because when you're in pain and you're unable to do because of the pain, then that affects so many other aspects of your life.
Absolutely. There's just no way about it. We're very complex creatures. And we have a soul, we have a spirit, we got the physical, the chemical, the biomechanical and all that stuff involved with our wellness. And you just can't focus on one and ignore the others.
Right.
Absolutely.
Right. How do you define wellness for yourself personally and within your business?
Oh man, that's for me personally, you wake up in the morning and say, how do I feel? Am I able to stand straight up, boom, and hit the floor running? Or am I kind of, oh man, I got to warm up a little bit, things like
stretches.
that. But for me, wellness, yeah, definitely everybody wants to feel better. I want to feel better.
Yeah.
But as you know, wellness also is strongly related to function. How do I feel, and can I function? Can I do what I need to do?
Right.
And can I do what I want to do?
Right.
If I feel good, but I'm sitting in a chair all day, that's not wellness. That's not good health. It won't be for very long, because eventually it'll catch up to you as well.
And then you won't be feeling so good.
Yeah, so it's definitely from a personal point. It's how you feel and how you function. And that's really for most patients coming in. Why are they coming in to see you? Why are they coming in to see me? They don't feel good.
Right.
They're in pain. They hurt. So yeah, it's about feeling, but it's also about function. And once you can deal with the pain, deal with the function, then we talk about, okay, what are the root causes for why you're not feeling well? What are the root causes for why you're not moving very well? And then we get into a lot of other things. We get into, diet. We get into environmental factors, toxins and things like that. So that kind of leads us into the more important foundational things that we need to get to with our patients.
Yeah, often we'll have, clients come in and they're coming because they're in pain. I would say that is mostly why, other than their doctor told them to come to therapy.
That's right. My insurance will pay for it.
Right. But they're in pain and they want to get out of pain. And, when we do a great job, we get them out of pain pretty quickly. Mm-hmm. And then they're like, okay, great. I'm out of pain. I'm done. And we're like, well, no, not quite. Yeah. Because as you mentioned, you may feel good, but depending on the structures and how they're aligned, if you're sitting all day, if you're tired, if you're at the computer, a host of different things. Where's the pool? How's the muscle tone? Is it balanced? Are you out of balance? Then it's like, well, yes, you're feeling better, which is great, but we haven't changed the reason you came in, right? So the reason you had pain in the first place. You had pain because your hamstrings are tight and your quads are weak. So it's pulling on your hips, it's pulling you out. So you're uneven, your pelvis is out, your SI is out. So you may not have any pain. However, your hamstrings are still tight and your quads are still weak. Yeah. So we got to start balancing so that you're not right back in 3-6 months because we didn't change anything. Yeah. So,
and I do that with my patients all the time. I says, I get you out of pain. You have your spine's aligned. I put you in pain. You walk out the door and all of a sudden, boom, you're right out of alignment again. Why is that? Because your soft tissues, your tendons, your ligaments, your muscles are not holding the adjustment. And that's where he says, you need some physical therapy. You need to strengthen that core. You need to, lengthen those hamstrings. You need to, those hip flexors are tight. Your iliopsoas muscle is, on fire and you don't even realize it. Yes. And it has to be released and you have to have proper function. So why do you think professional athletes have personal trainers all the time? And they're stretching and they're exercising. They're on special diets. They're, that's high performance. Yeah. You just want to go day-to-day life. You still have to do that to a lesser degree to maintain health.
To do something.
Because, patients will come to me and say, oh, I'm out of pain. I don't need to come in anymore. Well, that's fine. I understand that. That's the mentality. Well, you can come in once a month and let's keep you in line. Let's keep good maintenance. Or you can come and see me for 12 to 16 sessions once every year or two. What do you want to do?
Which one? Because we're not changing the alignment.
And you will be back. And you will be back. And each time you come back to me, you're going to be in worse condition. It's going to take longer to get you better. And you're causing damage to your joints. And eventually, those joints will never recover. And so then you're talking, well, now what do I do? Oh, you're doing injections. You're doing, replace steroids. You're doing joint replacements. Yeah. And so for those that, some things you can't control, but there is a lot that we can control early on.
If we catch it early.
Yeah. And I tell patients all the time, well, if I had you 20 years ago, I could have done a lot more. And now my hands are kind of tied. Yeah. And we're basically in pain management mode. Right. I can't get you out of pain 100%. We're in pain management mode. And that's fine. There's a great need for that. But on the other hand, if they do what they should do, and do what we all should do, then you can save yourself a lot of
Yeah.
suffering, and you will have a higher quality of life to your last day here on earth, you know,
Yeah.
and that's the thing, you know.
Yeah, we're always trying to catch people before
Yes.
surgery. Like, well, I got to have surgery, so I'm just going to, like, yeah, but if you come in, two things could happen. One, you may decide if we get you balanced, I mean, as far as muscles, the tone equalized, what needs to be strengthened, what needs to be stretched.
Yep.
Then you may not need the surgery.
That's, yeah.
Or if you still need the surgery, you're still in pain, then afterwards, your rehab is going to be so short.
Yep.
Because if you don't do anything prior to, then you're just getting weaker and weaker and weaker. And those muscles are getting tighter, tighter, and tighter. If you decide to have the surgery, then fine. But because we've been stretching and strengthening, the rehabilitation part of it is going to be so short because you're already halfway there before the surgery. And the surgery is going to set you back. So if you don't, you're already here.
Yeah.
And then you have surgery. So now you're here.
Yeah.
So now you got to make up all that ground.
That's right.
Versus doing something before. You're at least kind of here in the middle. And then you get that setback and it's not as extensive to rehab and gain the function that you trying to get to. Yeah.
And that's a concern of a lot of patients, especially half of my patients are geriatric patients, you know, and the biggest problem is they don't want to do surgery because they know how difficult it will be for them to recover, and they're worried about not even recovering totally. Yeah. I don't want to end up in a wheelchair or end up in a nursing home. If I get the surgery, that's a strong possibility. I go, well, yeah. So to avoid that, you know, that's what we're talking about, is being proactive before you get to those years. Yeah, exactly.
And even some of the clients that we see, it is like, they're like, oh, how long have you been experiencing this? Oh, well, it's been about a year. Or it's been 3 years. I just figured it would go away.
That's right.
What was your first indication after 3 years? It wasn't going away.
Yes.
Or, yeah, I had this, and then that led to this, and then that led to this. I'm like, yeah, did you do anything about that when you first had that ankle? Yeah. Oh, well, no, I just, you know, kind of hobbled around on it. Then my knee on the left side started hurting. Then my hip started. I'm like, yeah, you know, that's all because of the ankle.
That's right.
That happened like 3 years ago that you probably could have fixed and avoided all this. So, yeah, being proactive is definitely the key. What are some things that you do personally to be proactive about your wellness?
Absolutely nothing. You know, doctor, heal thyself. You know,
do what he does.
Practice what you preach. Yeah, that is always the challenge, because and you know, I was looking at some of your questions that you had on there, and I was like, man, because as you know, when you're in business for yourself, it doesn't matter whether it's healthcare or anything. You're an entrepreneur. Yes. You own your own store, your shop, your restaurant, your salon, whatever it is.
Busy.
You are busy, busy, busy. You are burning the candle at both ends. Yes. And definitely we put ourselves at the bottom of the list. And so I'm guilty of that just as much as anybody else, even though I'm in the healthcare, you know, community. But eventually occasionally you get one of those wake up calls and you say, okay, I can't do that.
Yeah, I can't continue to go down the path that I'm on.
Definitely, you know, try to watch the foods you eat on a regular basis. Definitely heavy into supplementation, because I know the great American diet is not very good. It lacks in a lot of minerals and supplements. Yes. So definitely do that. I mean, recently getting more sleep. That's huge. Staying well hydrated. So I drink lots of water, more than I used to. Get more. Probably on average, I get a couple hours more sleep than I used to, maybe even 5-10 years ago. And also keep moving. I don't really exercise anymore like I used to, but I walk. You have to walk. Yeah. So at least do that to stay moving. It's a great stress reliever. If I'm feeling really good, you know, I'll walk fast, you know. Try to do a little power walking, yeah. I do it at night so no one can see me. What's that fat guy doing out there walking down the street?
Why is he walking like that? Somebody chasing him?
So, I mean, outside of that, if I do get the warning signs, I kind of know what I need to do. And you know, I am not the best patient, so I'll admit that. Still working on some weight issues. right now, and that's always been a struggle of mine the past 15 years.
Yeah.
And, I probably should get a good physical just to find out where everything is as far as my blood levels.
Some of that Western medicine.
Man. Well, Western medicine is good. I mean, it's good to get some blood work done.
Yes. When's the last time you had blood work?
The last time I had probably was last year. Because I've always, high cholesterol runs in my family. It's hereditary. My dad had cholesterol of 530, but he was a tiny, skinny little guy.
Yeah.
And that was the only marker that was ever high.
Yeah.
So he didn't die of heart issues. He never had a stroke or anything like that. So, those are helpful, but they're not always,
right.
Got to put you on a statin because you got cholesterol of 530. So that's not necessarily the case. But, so I've always had tendency for higher cholesterol. My high triglycerides, of course, that's more related to diet. So it's always been high. Even in college, I had them a little on the higher end because I was eating macaroni and cheese. And
what are you supposed to eat? I mean, they have a buffet.
Yeah.
And most of it is not healthy.
No, it's not exactly right.
Like they have all this fattening, greasy.
Oh, yeah,
food.
exactly.
And then a small tray of salad.
I know. That's it. So, and that was the quick and easy way to do it. But yeah. So, and I've had some high blood pressure issues, which I was born with a defective mitral valve in my heart. So, nothing serious, but I do get palpitations, and if my blood pressure rises, so I have gone to see a cardiologist, get the the echocardiogram, get an EKG, get a stress test, just to make sure that
being proactive.
Yes, I want to know what's going on. My partner, he passed away from a heart attack, cardiac, event, and he never really found out if there was anything going on there. He kind of said, "Do I have COPD because I smoked for 35 years or whatever it was?" And he always asked, "Well, do you think, Mike, I got some cardiac issues?" I said, "Well," I said, "Mark, if you don't go find out, you won't know." "Well, I'm not going to take their medicine and stuff. Anyway, I'm not going to follow that route." I said, "Well, you don't have to, but at least you know what's going on.
Information.
And you have information, then you can know that this is what I can do holistically. This is what I can do from an exercise point of view." And so from that standpoint, there's nothing wrong with getting information.
Yeah.
And so that is helpful to make sure that you get that done on an occasion. And if you're having issues, let's get to the root of it. Let's find out what's going on. I mean, MRIs, CT scans, Dopplers, DEXA scans, blood work. That's all very useful and helpful.
Yeah, and it's information. It's
information,
not, I know, like my husband, hey, honey, if you're watching, he very rarely goes to the doctor.
Yeah.
I'm fine. I feel this. I'm fine.
Sure.
And again, and he's not one, that's big on medicine. And I'm always like, okay, that's fine. You don't, just because you go and get the test done and find out what's going on, it's information. If you don't know, you can't do anything, whether it's Western medicine, Eastern medicine, holistic. You can't do anything if you don't know what's going on. And it's not to scare you into, oh, I got to take this now. It's information.
Yep.
So then you can know, oh, okay, you know what? My blood. So last year I got my blood test done, and it's time for me to go back. So I don't have any results. But last year, and the doctor, she's like, okay, I'm not going to put you on anything because we've already talked. She knows how I feel about these things.
Yeah, sure.
She's like, I'm not going to put you on anything, but you need to do something about this. And I was like, okay. And one of it was cholesterol, and that runs in our family too, high cholesterol. And so, as well as high blood pressure. So it's like, okay, got to do a bunch of things, but changing how I eat, trying to be more active, different things to naturally bring those things down, being more mindful, not as much red meat. I love hamburgers. So now I've been trying to do chicken burgers instead of hamburgers. So I still get my burger fix.
Right. Yeah.
But without, the beef all the time.
Right.
But not all the time. But again, it's now that I know these things, now what supplements what, like you said, minerals, what other things are deficient inside me that I can start taking to kind of come together holistically and battle both without being like, oh yeah, I'm taking this medication. So when I go back, see how I did. But when I go back, hopefully those numbers are coming down a little bit so that, and she was like, you're borderline, but I just want to make you aware. But again, if you never go in and have any tests done, then you never know.
Right. You lose the opportunity to be proactive.
You lose the opportunity.
And that's the sad part about it, because as you know, when a patient comes to us at a certain age or state, there's only so much sometimes you can do.
Yeah.
And they're limited by what the damage that's already been done that way cannot be reversed.
Right.
And so that's key. If you are proactive and you know what's going on in the present, then you have more options.
You have more options.
Choices. And that's the good thing about it. If you start early and keep on it, then you need to need to be doing that.
And you're not reactive.
Right, exactly. Yeah. Well, that's the whole mindset of Western medicine.
It's reactive.
It's the common phrase is it's a sick care system. It's not a health care. They only pay for things if you're sick.
Yeah.
So we never go to the doctor until we're sick. Yeah.
Right.
Or we're laying on the floor and you got to call, 911 and get a trip to the ER. You know, I mean, that's insurance pays for that. Well,
it's a $10,000 trip.
Oh, geez, yeah. Insurance won't pay for this diet. They won't pay for my supplements. They won't pay for my laser treatments or my Calmare treatments, but they'll pay for this injection. And if I gain 40 more pounds, I'll qualify for the lap band or the gastric bypass.
And they'll pay for that. Yep. So there's really no work I have to do.
Right.
I just let life happen to me, and then let the healthcare system fix it.
And that truly is a majority of Americans. That's where they fall in line. Live like they have, and you want to enjoy things. You want to do whatever you want to do, but eventually there's consequences to everything. And based on genetics, some people get away with it. Most of us don't.
And, I think it's a lot about, if you want to include diet, if you want to talk about exercise, it's all about being consistent and moderation. You can't, even as far as exercise, you can't just go all in. Oh, I'm going to work out for an hour, 7 days a week. Not going to happen.
We see those patients a lot. They come in.
You're going to burn out real
fast.
What'd you do?
You're not 20 years old anymore. Come on.
Well, because I needed to because I was trying to get off my blood pressure medicine. So I was just going to go to the gym and do cardio every day for an hour. And I've been doing it for 2 weeks and now I can't move.
I know.
Yeah. That sounds about right.
That's right.
And then now we're here. So it's, about moderation, doing things and being consistent with doing it. Wellness is not there's no end goal to wellness. There's no end point. Even if you achieve the goal you set out, once you achieve that, you're like, oh, okay, I did pretty good. Maybe I can do a little bit more, or maybe you're able to, like, it's almost like now that you've achieved it, you can set a new goal.
Right.
Like, oh, I was able to walk a mile without stopping. Now I'm going to go for 2. Now I'm going to go for 3. So, the mountaintop is never ending.
Yeah.
It's always a climb, and hopefully at some point it plateaus where you don't feel like you're going up. But wellness is never a peak to get to and conquer. It's a lifestyle.
Exactly. That's right.
Something you'll be doing forever.
Yeah. It's just a way of life that you choose. I mean, we all would like to do a lot more than we are able to do, but as we become wiser, we don't do more and set more goals that are unattainable. We should really set more goals that are achievable and do things in moderation. We have to have balance. That's the biggest thing that we talk about with patients, and even in my own life. Am I in balance? Where is the out of balance in my life? And so that's very important. To have that. You don't want to emphasize one area and over against all the and neglect the other ones. That's right. You know that if you focus on your business and you neglect your family, that's not going to be good. You know, you have to balance those things out so that you have the healthiest life that possible, and that you can enjoy life as much as possible as well too.
And that's definitely hard. You know.
Yep, it is.
For myself, it's like, okay, I gotta work, and then I'm like, nope, I gotta work out, I gotta work out. Nope, I gotta do this for family. Another guest that we had on, she has younger kids, and you know, she's also a business owner. And I was asking her, how does she manage work and family and maintaining her wellness? And she said that she has a transportation company that she uses to cart her daughter, who has a busy schedule, back and forth to different things. And I was
wow. Okay.
That was a great idea. I should have thought about that.
That's thinking out of the box. Yeah.
I said, because I spend so much time on my free Uber job.
Oh, yeah. Yeah.
Taking and picking up my kids for different things, for work, for activities. I was like, man, I could have used that about a month ago when I was like, if somebody else has put something else on my plate to do.
I know. That's
right. Like, I don't have time to do stuff for myself, even to the point where it's like, okay, I'm going to get up half an hour early so that I can have that me time. Right. I can have time to read, to meditate, to read the Bible, to get focused for the day, to exercise, to get my mind right.
Yep. That's huge. Because if you can't do that, then at some point you're going to be good to nobody, because you can't function at a level where you can make good decisions. Right. You can have the proper attitude, spirit. Because I see patients every day. They come in and they're miserable, and I need to be there to lift their spirits, encourage them, give them hope, whatever that is. And if I'm not in that frame of mind, I'm going to look at them as a number and say, okay, just boom, boom, get them out of here, and I'm done. You know, so in order to be the most effective, you know, physician, healthcare provider, I need to be in the right state of mind, and right state of health as well too.
And when we're not well, how effective are we?
You can't. No, you can't.
We're helping.
Exactly.
You know? Like, your blood pressure is super high, and so is mine. So
now, at some point, that does help when I talk to patients, because I am one of the things that was always my pet peeve is when you go to a doctor and, you know, or somehow whoever it is, you know, you go to a personal trainer, they're fit, they're ripped. It's like, okay, I know this is your thing, but you know, come down to my level. Can you relate to me?
Right.
You know, I'm not going to ever probably get to the point where I'm going to be ripped, you know, and you know, 6% body fat, you know, whatever it is, you know. So can you relate to me on my level? So for some of us, that is helpful. But on the other hand, you definitely have to take care of yourself too. Otherwise, you know, I know chiropractors that they burn out in their 50s and they quit, or they just, you know, they just don't want to do it anymore, or their health problems, and they, you know, they're not here with us anymore. Other ones, they can do that. And got a colleague of mine, he's 78. He's still doing Calmare therapy. That's all he does, even though he's a chiropractor. But he's still playing pickleball and he's very active and stuff. And so he knows how to moderate.
He's found that balance.
Exactly. Yeah. Good balance. Yeah. Enjoys life to the fullest. And can't do everything that he used to, but he's still doing things that he really wants to do and loves to do. And he's still treating patients. And that's the beauty of what he's able to do.
Yeah, he's not burned out and like,
nope.
And like, oh, I don't want to see anybody because I'm just tired. I've been working too hard. I don't have that time for me.
Exactly.
Yeah.
Yep.
Can you describe any holistic therapies? I know you mentioned the Calmare and the laser. Any other like holistic therapies or practices that you find effective for yourself, for your overall wellness that you do?
I mean, outside of just nutrition and supplementing nutrition with supplements, you know, medicinal grade, not the CVS or the GNC type, you know, vitamins, and I'm sure you're very well the different qualities of supplementation. So that's important. and then of course exercise. But as far as with my own clinic and my own patients, I stay in a very specific lane. So we talk about healthy living and holistic options, but I refer patients out quite often. You know, this is what I do. We'll accomplish our goals here, but then you need to move on. You know, so I have a working relationship with probably about 3 or 4 functional medicine doctors. A couple of them are MDs, a couple of them are chiropractors. So I will definitely, you know, even my staff, I push my staff over there to hey, go see Dr. So-and-so and get some more blood work done, get some more testing done. Yeah. You know, they have hyperbaric chambers, they use IV infusions, and they'll use some acupuncture and some other things like that. But a lot of chiropractors, we have a reputation of having 5 dozen different therapies out there, you know, and my opinion, and it's not always everybody else's opinion, is that be really good at a few things. Know your limitations. I'd rather be really good at a few things than being mediocre in a lot of things.
Yeah. Yeah.
So that's why, could I do physical therapy in my clinic? Yeah, but I wouldn't do it myself. I would bring in somebody else. But at that point, that's not really my goal, is to be the mall of healthcare.
Be the utility.
Right.
What is that?
Yeah.
The little knife that has
the Swiss Army knife.
Swiss
everything.
Army knife. There we go.
Says, no, I mean, in the more wealthier, say, chiropractors, they call multidisciplinary practices. So they'll have an MD or a nurse practitioner. They'll have a physical therapist, you know, things like that. And I don't decry that from anybody, because that can be very helpful for a patient. They need multiple things. Mm-hmm. But as for me, at my stage in my professional career, it's like, no, I'll do a few things very well, pick and choose, and then I will consult with the patient and move them in to the next direction. So I consider myself one piece of the puzzle, not the whole puzzle, for healthcare.
What if wellness was a superhero?
Mm-hmm.
What would his name be, and what would his superpower be?
Oh, man. His superpower would be, for wellness, would be, oh, man, I got a couple of ideas there, but one would be somebody who, the brainwasher. If we could change the way people think, then everything else is secondary. The brainwasher. And I mean, brainwasher. And it's not somebody taking over your mind, but somebody helping you know how to think about yourself.
An open mind.
Exactly. Okay, this is the way I need to think. This is the choices I need to make. These are my options. And what's the best choice? Yeah. So it really is with anything whether it's our health, whether it's your job as an employer, as an employee, whether you're a CEO of a company, whether you're a professional athlete, your mental state and how you think about things really affects your performance, your outcome, and your well-being. And so, I mean, people say, oh, I wish I had more energy. The Energizer Bunny, Well, energy doesn't always mean that you're producing, you're being effective, that you're happy. I mean, if you have energy to do everything, you're going to run yourself into the ground and run yourself right off the cliff. And that's
Have you ever seen the Energizer Bunny? Just,
exactly. So, I mean, if I could make people think a certain way, then to help them, not to control them, but make them think differently, then that is sometimes 50% of the battle.
It is.
To feeling better, to being healthier, to being able to do what they really should do in order to help themselves,
Do you all do a lot of education?
Yes. Oh, yeah. I mean, it's really one-on-one. I mean, I don't do a lot, say, in the community. I do some talks here and there, and we used to do seminars, dinner workshops for chiropractic. We would do it for the MLS laser therapy. I haven't done any for the Calmare, because that's really a narrow realm. And most of those patients aren't going out anyway. They're in too much pain. But so most of it's one-on-one. I do a lot of consultations over the phone. because I don't charge for that, and I will also do consultations in person, and I will spend usually an hour with a patient just talking about things. You need to develop that rapport. They don't trust you. They don't think you know what you're talking about. They're not going to do what you ask them to do anyway. And it's tough enough to get them to do that anyway, even when they do trust you. Just human nature. So I do a lot of one-on-one education.
Yeah.
And as a chiropractor, and of course as a physical therapist, you spend a lot of time with your patients over the course of treatment. So we have a lot of time to talk.
Yeah.
And that's really when we start making an impact with them. Say, hey, maybe Dr. Mike really knows what he's talking about.
Maybe they do know what they're
maybe I will
about.
try that.
Yes. Like the patients that they come in and they leave. I'm great, and they come back. The pain's back. I'm like, okay, so how do we do with our exercises?
Yep.
I mean, they went well. I did them. I said, okay, well, show me what you did. And
yes. Yeah.
either they can only show me one thing, or they show me something. I'm like,
yeah.
Well, who told you that one?
Yeah, exactly.
Who showed you? I think you're taking two and kind of merging them together, or you just made up your own. So education definitely is key. And as you said, when people trust you and know, like, and trust, when they know that, they're not just a number and you have their best interest in mind, and then they are more willing to be like, you know what? I did what you said, and you were right.
Yeah.
Like, go figure.
Yeah. Sure.
And it could be just because history or other things they've done, or people that have told them things for whatever reason, and they're skeptical. We are skeptical in general. I was like,
always.
what are you trying to get out of me?
That's right.
And, I guess that when you have someone that truly is like, oh, I'm just trying to help you. You may need to look into this, or you heard about this, or check this out. They're like, oh, that did help. I'm like, yeah, I was doing it because I thought it would help.
That's right. Yeah.
Not just trying to twist your arm or trick you or into, and like you said, whether it's here or whether it's referring to different disciplines, you may need to go do this. There is I'm not going to think of it now, but there's a place downtown Chicago. They do this scan. It's a full body scan.
Okay.
Or you can just have your head scanned, or you can just have your trunk scanned. And, earlier we were talking about being proactive with information that you have.
Right.
And I kind of got on this little trip with a patient that came in, and she was having some issues, and then ended up having like her regular scheduled, I think it was the colonoscopy, and then that found something, and then that led to something else, and that led to something else. And she was like, had she not had the colonoscopy, then none of the other things would have been found. And we were talking about this scan, because this scan does that. Of course, it's not covered by insurance.
Of course, nothing is that works.
Because, well, like you said, it's not.
Yeah.
It's not retroactive. It's not reactive.
Yeah.
It's proactive. So if you go and do the scan, you found out information before you're actually sick, and before you're affected by it. So it can find like cancer and other things, polyps, fibroids, blah 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 blah. Other things going on, just disturbances in the body, that you can figure out what you want to do with. And I was like, I might need to go and do that. We would like to thank our special guest, Dr. Mike Faber with Orland Park Laser, Calmare, and Chiropractic Center, for joining us for this episode of What Does Wellness Mean to Me? And we will see you guys next time. Bye-bye.